This is Channel 9 Eyewitness News at 5. Coverage you can count on.
Prescription migraine treatment, birth control, and custom compound dermatology services.
Millennials are being targeted with medical ads while scrolling through all of their social media, making it easier than ever to get boutique care without ever even talking to a doctor.
Channel 9 investigative reporter Carla Ray looked into how this trend is changing modern medicine and found out why it's not always safe.
Skip the waiting room, take back your free time. The marketers behind this online prescription birth control service are hoping their message is enough to stop your scroll on Instagram.
We have capabilities of targeting the specific audience that we want based on maybe their likes, maybe even dislikes, their age. For us as a marketer, it's gold to be able to reach that audience with these targeted ads.
Tom Jelneck with On Target Marketing says his client portfolio is about 10% healthcare related, and he says many opt for a social media marketing strategy.
We're going to see more and more of this. It is kind of the wave of the future in terms of healthcare.
Other targeted ads on Instagram and Facebook offer prescriptions for migraines, sexual health, custom prescription dermatology, and prescription serum to grow your eyelashes, all without a visit to an actual doctor's office.
Is that safe?
That's a really good question. The short answer, I would say most of the time, yes, but you never know because sometimes no.
Dr. Alex Kassler is the medical director for Orlando Health's Department of Population Health. This hospital, like many others, offers telehealth services, which allows you to receive a diagnosis or prescription over the phone or FaceTime after a discussion, but without an actual visit. It's a service that skyrocketed in popularity. Its use growing more than 1,200% from 2012 to 2017.
Obviously, when something like this comes up, everyone wants to get in the game, right? Number one, there are dollars to be made. Number two, convenience is appealing.
The companies that targeted us while researching this story didn't require a conversation with a doctor. Instead, an online questionnaire. And while Kassler admits most of the services being offered are generally safe, there are always certain risks for certain patients.
Medical care is a little bit more complicated than non-medical people think that it is. Yeah, sometimes it's a little bit less convenient to sit with your doctor and really get to know a doctor.
So Dr. Kassler says some of the risks, particularly with the really popular birth control app, is that birth control can sometimes cause blood clots. It all has to do with your blood pressure. So if you're guessing what your blood pressure is when entering that questionnaire online, that can lead to some risks for certain patients.
And Carla, one of the companies, only one actually featured in your story, got back to you about how they approach patient safety.
Yeah, the CEO of the prescription skincare company Muesli called me directly. We talked for a long time. He says that their staff has even identified conditions just based on submission photos from some of their patients. It could be serious skin conditions, even skin cancer. So those patients were referred to in-person doctor visits. He says the wide appeal of their product specifically is that, as we know, it can take a long time to get into a specialist like a dermatologist. So this makes it easily available to the mass.
It is so tempting. As you said, it's being marketed right there to your phone or your tablet or your computer.
Yep. These ads are really savvy.
All right. Thank you, Carla.